I'm here with Kim O'Leach with Family Innovations LLC. They specialize in assisting folks that may have mental issues. You know, there's folks in your life, they get into depression. Someone could have passed away. They could have had a breakup. Something tragic could have happened that drove them into depression. They just can't seem to get out of depression. It might be some hallucinations going on. It might be a person that has an extreme reaction. Maybe they're normal and you get them upset and all of a sudden the reaction is out of whack. But anyway, we wanted to kind of go through the different types of issues a person may have mentally if there's an imbalance or dysfunction in that area, and then what the signs are that Family Innovations look for so that you can know to look for that in your family members, loved ones, and friends and see if they need some assistance. And if so, we want you to call Family Innovations, connect with Kim O'Leach and his team in order to get that person the necessary help that they need, because it is a serious topic. So Kim, you want to kind of go through some of those signs?
Oftentimes, see what you're going to see, people start to isolate. People do not want to, their routines have changed. A lot of times people don't want to talk, in particular when they've been through traumatic situations. So we recommend that a person come into our program, get an assessment with our psychiatrist or one of our therapists, and then we can make an appropriate diagnosis and find out how best to treat you for your illness.
And something else that I've seen someone do before is kind of just be in the dark. Close all the windows. They don't want any light to come in. They don't want any company. They don't want to go anywhere. Just like a pure state of depression. Have you seen that?
We've seen it so many times. And the best thing to do in situations like that, if you know somebody that's going through stuff like that, give us a call and talk to us on the telephone. Or we have a website that you can go to, www.familyinnovationsllc.com, to make a referral. You can make a telephone call. You can call your local mental health agency, but you want to get the individual get help somewhere, and we would like to be the ones to provide that treatment.
What about schizophrenia? How can you tell if a person's schizophrenic?
Well, only a psychiatrist can actually tell if a person is schizophrenic. Sometimes that you may have indicators. Say, for example, a person might be having a conversation, may be talking to themselves out loud, and they may not even know they're actually doing it. A person might tell you they're hearing voices. You might see people do things that we don't particularly think that is normal. Maybe pacing back and forth, maybe on the sides of the road or places like that wouldn't be normal for you to do those type of activities. Anything that you see kind of what we would feel out of the ordinary, it might be time to make a referral to us.
What about if an individual is bipolar?
Okay, for the same scenarios.
Really?
Yeah,
wow.
Same
so you definitely need a professional to say which one is going on.
Yes.
I never thought of a bipolar person hallucinating.
Yeah, it could be any source of issues that we could cause these type of diagnoses. And so the psychiatrist and the therapist, they are the ones who will make sure those individuals are properly diagnosed.
So what is it when you see someone that's so frustrated? They could be a normal person, but if they get upset, they go into like an extreme fit of rage that's out of this world. What would you place that under?
There's so many traumatic, life-changing situations in people's lives every day. I mean, people lose their jobs. People have death in their families. Some people don't know how they're going to make it from one day to the next. People lose their homes. Anything could cause a person to kind of lose it. And so what you might think is small, or you might think is small in a person's life, could be tremendous in their lives. So we can never say what
their tolerance level.
Right,
what their tolerance level
that's
is.
right.
Yeah.
It could drive somebody over the edge. And we're here simply to say, you don't have to do it alone. We have a whole team of professionals to give you some help. And then although we are your professional team, we're going to have your natural supports participate in the treatment as well. So it's a whole that goes back to the holistic approach that we talked about.
Well, I think it's an excellent program, and I think if someone knows someone that's having one of these experiences, they definitely need to contact Family Innovations LLC. Your information is coming up on the screen periodically for folks to write that down. but also they can find you on the internet as well. What's your website?
www.familyinnovationsllc.com. And our telephone number is 704-371-3050.
Yeah, we definitely want you to write this phone number down. Something unique that Kim is going to elaborate on is that you can be genetically predisposed to having mental issues. However, you don't have to be. And it could actually come on you at any age. Now, that is what's surprising to me when you share that information. So it could be a child, it could be a teenager, it could be a young adult, an older adult. All of a sudden, we have a situation going on.
Right. There's no, it's not clear cut for anyone. Anyone can, come up with these diagnoses. You never can tell what age, what, is going to happen, or whatever the case may be. The thing we're saying, you don't have to live with it and go through it by yourself. We have programs for that. And oftentimes when people have these diagnoses, this program is about giving everyone the right and opportunity to be able to go to school, have a job, graduate from college, have a family, have their own place. A lot of times individuals come in our program, and because they have been labeled or had the stigma of having a diagnosis of bipolar schizophrenia, they're looked upon as people who we don't want to hire for a job. We don't want to give them an application. We want to tell them.
It's a bunch of people working like that right now.
Right, yeah.
That's not diagnosed.
Right. Well, one of the things we want to do is encourage and empower people to say, you know what, regardless of your diagnosis, you can still get these opportunities. That's what ACT Team talks about. Certain members of the ACT Team, their specific jobs, vocational specialists, to help individuals with these diagnoses get jobs. If a person has substance abuse, again, we want to try to help you, deal with your diagnosis of substance abuse, but don't necessarily say life is over. You can still, manage these symptoms and still try to live a normal life. And that's what we're trying to empower here.
Okay, so also our veterans, right? And you are a veteran.
I am. I'm a proud veteran, United States veteran, U.S. Army.
And we thank you for your service.
I really appreciate that. One of the things that we did, we are now accepting TRICARE applications. We are a TRICARE provider, and that insurance is for veterans and their dependents. I'm a very proud veteran myself. My certification in peer support mentions that I am a veteran, and so I tried to make sure that one of the things that we're looking at is trying to identify veterans that are homeless, veterans that are in need of services, psychiatric services, and enroll them into the program as well. We have seen a tremendous amount of veterans that are not being taken care of in this community. They've been turned around in places where they've come.
And that's sad.
Yeah, they have PTSD and all type of things going on, and no one wants to serve them, and we want to serve them here at Family Innovations.
And what's unique is a veteran not too long ago told me that many of the homeless people that you see on the street here are veterans.
Yes, ma'am.
There's a high percentage of veterans that are homeless.
Mm-hmm.
So sometimes you're looking at that person and you're prejudging. You don't know what that person has been through.
Right.
But you might, hey, he looks like he can get a job, he needs to go get one.
Mm-hmm.
But you don't know what traumatic experience they've been through.
Absolutely. Absolutely.
All right, so if you're in a situation where you've had a traumatic experience, you're feeling depression, maybe you're hearing voices, there's something going on mentally, you're going to fits of rage for no reason, you're isolating yourself from others, you don't want to be bothered, you need to get some assistance. And if you have a family member, loved one, or friend that you see signs based off of what we talked about today, we want you to give Family Innovations a call.